Check this out. This is what doctors are calling the kidney stone belt. This is an estimate of the states more prone to suffer from kidney stones. Ouch, right? Yeah. However, there has been an uptick in cases among not only adults, but children as well. Here to talk about this is Dr. Douglas Dow, a urologist with Memorial Hermann. Thank you so much for being here this morning. This is a very uncomfortable subject for a lot of people.
Thank you for having me. It certainly is. And what we have seen is that the incidence in kids has gone up. Statistically, we would say around 1% of boys and around 0.5% of girls would get kidney stones. So it's not a huge amount.
Right.
However, the incidence has gone up around 25 to 30% in kids.
Why is this?
Good question. Not exactly known. A lot of it is thought to be, of course, the excessive heat. Dehydration is the biggest component of what contributes to stone disease. But also some thoughts are maybe some dietary factors,
right,
maybe some environmental factors, and also there's a genetic component. Just like some people have to wear glasses, some individuals are more prone to getting kidney stones.
I was talking with a pediatrician about this, and she was saying that, you know, children are doing more adult-like things, and with that comes the diet. And she said a contributing factor for her, she thought, was processed foods.
Correct, no question. Sort of the biggest risk factors that are dietary are sodium or salt with a lot of processed foods and sweet beverages. There's a lot of thoughts on beverages, but really the ones to avoid are sugar-based colas, sugar-based non-colas, and fruit juice.
What are some symptoms of kidney stones within children?
Good question. A lot of times kids will present either with blood in their urine, or they will develop back pain on one side versus the other. And the classic kidney stone or passing kidney stone pain is back pain on one side that radiates towards the abdomen and towards the belly, a lot of nausea, and difficulty finding a comfortable position. They're just kind of squirming around and can't sit still and find something comfortable.
Anything parents, children can do to prevent this from happening?
Good question. The biggest thing they can do is hydration.
Yeah.
They've got to drink a lot of water. The other thing is to try to avoid salt in the food and add lemon. Lemon contains citrate or citric acid, and the citrate prevents the two main components of stones, calcium and oxalate, from coming together to form a crystal.
And those suggestions are also applicable to adults.
Absolutely.
Wanting to prevent kidney stones.
Absolutely.
There was a time that kidney stones were more common among men. Women now, though, I guess are catching up? Correct.
Around the lifetime risk for a man of getting a stone is approximately 1 in 4 men. For women, we would say it was around 10% of women over their lifetime would get stones, but the incidence is going up for that. It's almost doubled in the last 10 years for women.
Symptoms among adults, are they different than those of children?
No, usually the same. However, for adults, they more commonly present with pain versus blood in the urine.
Yeah. Let's talk about this kidney stone belt. That's how we open this conversation. States within the South.
Correct. So the highest incidence of kidney stones are in the Carolinas, North Carolina and South Carolina. But if you follow from the Carolinas along the southeast part of the United States, including Florida, Alabama, Mississippi, heading west, including Texas and Arizona, the main contributing factor is the heat and also the amount of humidity along the southeast United States, causing sweating and just contributing to the dehydration.
Correlation with just that, dehydration.
Correct, absolutely. Yeah. You know, I'm going to keep harping on dehydration, but you've got to drink water.
Yeah. People who have kidney stones, is there a way they can reduce them at home?
Correct. The easiest way to do that, in talking to patients, they'd rather do it with behavior modification versus taking a medicine, which makes a lot of sense. It's really a couple things. One is to increase your fluid intake, increase your water intake, and a lot of beverages are okay to drink with the exception of the sweetened colas, sweetened non-colas, and fruit punch. Water, we used to think tea was bad, but actually taking in tea, the majority of tea is water.
Yeah.
So increasing that water intake along with tea is good. Avoiding salt and processed foods, and adding citrate or lemon to the water that you drink. However, it can't just be a lemon wedge. It really has to be like a half a cup or a cup of lemon with water.
So significant. We're talking
significant
about
amounts. That's correct.
Of lemon. Treatment will depend on the size and the location.
Exactly. And as you appropriately said, it makes sense that a golf ball sized stone in the kidney would be treated different than a pinhead that's about to fall into the bladder. Fortunately, we have a lot of minimally invasive procedures Probably 50 years ago, everybody would get an incision for a kidney stone. Now, that is extremely uncommon. We have non-invasive treatment, something called extracorporeal shockwave lithotripsy. People know it as sound waves. And also we have very small telescopes that can go in people without incisions to help clean out the stones, and use laser or the other destructive devices to break the stone and pull out the pieces.
Not fun.
Not fun.
Not fun at all. I know you have a busy day dealing with kidney stones, you were saying.
Correct.
Ahead. So we'll let you get to that. But we so much appreciate you stopping by,
Oh, my
having this
pleasure.
conversation.